We all know someone that currently has a heart condition or someone that had a heart condition. It may be a friend, your mother, your sister, your wife, or as in my situation, it was my husband, Brian. And I now realize that once you have a loved one that has a heart condition, everyone that cares about that person, their hearts are affected by this diagnosis as well. To start off, I want to tell you a little bit about my background and history, and about Brian and I. We first met back in high school. We started dating when I was a junior and Brian was a senior. It was pretty much love at first sight, and we knew that this friendship was a friendship that was going to blossom into something special. Brian was a year older than I was in high school, and he decided to attend the University of Iowa. I am sure his decision to attend Iowa had a little something to do with the fact that I already planned to attend the University of Iowa and major in nursing. In 1991, Brian and I were married. This was also the year that I graduated with my Bachelor of Science in Nursing and started working at the University of Iowa in pediatric cardiology and pulmonary unit. Talk about a wonderful life. I married my best friend, and I started my dream job as a pediatric nurse all in 1 year. Life was great. Over the next 17 years, Brian and I were blessed with 2 children, our son named Michael, and our daughter named Lauren. Again, we were living the perfect life. On Saturday, April 26, 2008, at 5:20 in the morning, I had to call 911 to get help for Brian. I had woken up to a strange sound, and I asked Brian, if he was okay, but he didn't answer. At this point, he was lying in bed next to me, experiencing a fatal arrhythmia. Of course, I didn't know what was exactly happening at this time, but I knew it wasn't good. So I had started CPR on Brian, and it seemed like the next 4 minutes lasted forever until the paramedics actually arrived. They worked on Brian to try to stabilize him for over 30 minutes at home before going to the hospital, where they eventually pronounced him as dead. I kept thinking, how could this happen to us? Brian was only 39 years old. A few weeks after Brian's passing, Dr. Terry Brennan came over to our house to review the autopsy results with me. I already knew in the back of my mind that Brian had passed away from something related to his heart. I just assumed it was a clogged artery, which may have caused a heart attack. I was in a state of disbelief when Terry stated Brian's actual cause of death was a condition called dilated cardiomyopathy, a condition that affects the heart muscle to the point where it may not be able to pump effectively. Remember, I've taken care of kids with dilated cardiomyopathy that were waiting for heart transplant, and these kids were sick. They were having trouble eating. They couldn't walk down the hallway without becoming short of breath or exhausted. Brian didn't have any of these symptoms. He was a busy, active father and husband. He was coaching our daughter's softball team, and he would actually run the races and line drills with the softball girls during practice. He wasn't complaining of anything. He was fine. A little tired maybe, but overall he was fine. At that time, I was in a state of shock. How could this happen? How could he have passed away from dilated cardiomyopathy? In my mind, remember, those patients are sick. How could I have missed his symptoms? As I started to research his diagnosis, I started to discover that sometimes adults present differently than children. Some information that I found stated that around half of the adults with dilated cardiomyopathy present with a fatal arrhythmia prior to being diagnosed with the disease. Brian was one of those cases. The only medical decision I was able to make at that point in time was to give the gift of life and donate his bones, tissue, and vessels. By becoming a donor, Brian's gift has benefited over 96 other people. These people range in age from a 14-year-old girl in Texas to a 78-year-old woman in Ohio. So today I'm going red for all the single parents out there. That have lost their spouse due to a heart condition. I pray that through our efforts today, there will be less single-parent homes that are caused by heart disease. I would like to leave you with one of my favorite quotes from an unknown author. Life is not measured by the number of breaths we take, but by the moments that take our breath away. I hope that you have many moments that take your breath away. Thank you.